Hey, good morning. This is Edward Ng with the Pittsburgh Foundation. Welcome to monthly COVID update call. Just want to remind everyone that we do record this meeting, and we will be publishing it for broadcast. Also, post any questions that you have in the questions area, and we will respond to all those after the webinar via email. And then without further ado, I'd like to welcome McCrae Martino. She's the new Executive Director of the Community Foundation for Westmoreland County. McCrae, take it away.
All right, thank you so much, Edward, and thank you for your help. Like Edward said, I am McCrae Martino. I'm the new Executive Director of the Community Foundation of Westmoreland County. I believe this is week 5. If I haven't already reached out to you or met you, I look forward to doing so. All of you who are on the call, you can feel free to reach out to me anytime. And let's get started with the call. So, per usual, we have a painting here courtesy of the Westmoreland Museum of American Art. This month's piece is called In the Garden by Theodore Robinson. Robinson's In the Garden was painted during the artist's early years of experimenting with the new techniques of Impressionism. In a light pastel color palette of blues, lavenders, pinks, and yellows, he depicts a woman tending pool beans in her small kitchen garden behind her home. The garden depicted is a particular place identified by Robinson in his diary as Gill's Garden, a site that he repeated in a number of his landscape compositions of the village. And so I want to thank the Westmoreland Museum of American Art for supplying the images and the background for us every month for the call. So moving forward, I just wanted to let you all know a few things in regards to CFWC, a couple announcements. Next Friday, the 21st, from 9 to 10:30, we have our Westco Nonprofit Networking event. It is part 2 in a series of our Welcoming Communities events around implicit bias and privilege. And so I encourage all of you to register. If you need information on it, please let me know and I can shoot it out. Edward, is there a way for me to post my email in the chat? I see so many screens on my end that everyone else can't see, so I'm trying to figure out.
I can put that in the chat for you.
Perfect, thank you so much. So Edward will put my email in there, and please feel free to reach out. The other thing is that for folks serving individuals in Greensburg and the 15601 zip code, we will be releasing our Greensburg Foundation Fund RFP June 1st, so in a few weeks. And then as follow-up, we will have an information session later in the month. And when we release the RFP, all that information will be in there. Other than that, I'm just excited to be here and excited to meet everybody. And so I'll turn it over to Alyssa from United Way. And Alyssa, if I forgot anything information that Phil usually gave in his introduction, feel free to add it.
Thanks, McCrae. That was perfect. Nice. We're excited to have you here as well, although we, of course, will miss Phil, but I know he'll still be working in the community. I was just reflecting back on the start of these calls, which was April of 2020. So we've been doing these now for a year. And the 3 start people was me, Phil, and Dirk Mattson, and now I'm the only one of that group left here. So I don't know what that means. So, okay, but anyway, so I want to give a quick update on 211. We are seeing steady calls as we have in the past year, still up significantly than prior years. Most of the calls in the last 30 days have been for housing and shelter, and about 82% of those are around rental assistance. So I know Dan Carney will be talking about that program and how people can access it when he's talking here later this morning. About a third of the calls are the electric, gas, water, people looking for assistance with that. And we do have some special funding to help people who are behind in their bills. And then about 12% are for healthcare and COVID. So those are people looking for sites for the vaccine, who may be also experiencing symptoms or have questions. And most of those actually around older adults, home care, and access for those individuals. And we are with our partners at Excella and Open Your Heart to a Senior, Faith in Action, and the county's AAA, still helping seniors get connected to transportation and appointments for vaccines if they haven't been able to get those yet. So still working on that, and people can access that by calling our United Way office or 211. And I know Texi's on the call for Jennifer, and I'm sure she'll talk about the food requests. We are seeing those down from this point last year, but still people are calling mostly to ask where they can get food in the local pantries. Other than that, our United Way Greensburg office will be returning to our actual physical office in June 7th. We'll be coming back in 2 teams and be there for 2 days a week, 3 days remote, and then that'll switch off in July, and gradually we will hopefully be back full-time almost in the office. So you can, as always, find us by calling our office number if you have any questions or needs, and we do get our emails, our voicemails through our email. So we're still accessible, but I'm excited to get the team back together. So other than that, and of course, we will still be masked, no visitors throughout the summer to our office. So just wanted to put that out there. And other than that, I will turn it back to you, McCray, and nice to see everyone. Thank you.
Thanks so much, Alyssa. Edward, and if you could move forward on the slide. Do I move that or do you? Okay. So first, second up on the agenda is Dr. Carol Fox, Chief Medical Officer from Excella Health, to provide us an update. Dr. Fox?
Good morning, everyone. It's great to see you again. It's hard to believe that it's been over a year that we've been working on this project, and it's really been an honor and a privilege to be able to work with each one of you. I'm happy to say that the numbers at our health system have stabilized. We still have individuals who are hospitalized, but those numbers are much lower than they were before. And our positivity rate of patients who are tested for COVID-19 is a little bit over 8%, which is, dramatically improved from prior when it was over 20% at certain points in time. At Excella, we have delivered over 41,000 vaccinations to individuals in Westmoreland County. And at this point, as of my last evaluation, 41% of individuals in our county were fully vaccinated and 55% were partially vaccinated. We will be starting homebound vaccines actually today in collaboration with Alyssa and the United Way and Bud Mertz and Emergency Management and our EMS partners in the county. So they will be delivering over 3,000 vaccines to individuals who are homebound. We are working towards beginning to offer vaccines to individuals on their day of discharge from the hospital. That will start on May 25th. We're trying to work towards placing vaccines in our primary care offices as a means to encourage individuals to receive their vaccination. There's still a decent amount of vaccine hesitancy here in Westmoreland County. Additionally, we have requested some Pfizer vaccine. We currently use Moderna, but we've requested some Pfizer vaccine in order to be able to provide vaccinations to individuals between the ages of 12 and 15. So we've reached out to schools and school districts and, to see if any of those are interested in partnering with us. And we've had a few who have expressed interest. I know many have already arranged partnerships with local pharmacies, which is great. Our goal is not necessarily that Excella give all the vaccines, but it's really to get shots in arms of people in Westmoreland County. So, in any way, shape, or form that you can obtain the vaccine for your adolescents, please do so. But we anticipate receiving Pfizer vaccine and being able to deliver that either at schools at their request or at our center in Norwin at the former Galaxy Fitness Center. Our Fry Farm Road site remains open for testing and for face-to-face evaluations. You can arrange that by calling 1-800-727-9558. And I also wanted to make mention of the fact that we have monoclonal antibodies, and we've been delivering that particular treatment to individuals for quite some time now. But monoclonal antibodies are really designed for use in the most highest risk individuals. So typically individuals with elevated BMIs, people who are over the age of 65, or who have a series of underlying health conditions, immunocompromising illnesses, immunocompromising medications, certain cardiac diseases, diabetes, on dialysis, sickle cell disease, and a few more. And it's really designed to prevent more serious illness. So designed to keep them out of the hospital, and certainly designed to keep them from dying. So we do have that available. We automatically, based upon your characteristics, if you're tested through Excella and you qualify, we contact you and offer you the infusion. Otherwise, physicians are able to get a hold of us. We've collaborated with both our own medical staff as well as others in the community, particularly MedExpress, et cetera. So if there's individuals who are interested and feel that they need that, please contact their primary care physician. And I guess I would just like to end with just expressing gratitude to each of you for the collaborations that we've been able to accomplish throughout this. I think we've worked very closely together, and we're very pleased to have had the opportunity to have participated in that. So with that, I will sign off, and unfortunately I have to actually go to another meeting. So I will see you next month, unless hopefully COVID ends and then we can end these meetings.
We can hope. Thank you so much, Dr. Fox. All right. I just want to double check. Commissioner Chu is not on the call, correct? He did not jump on, Edward?
I don't see him.
Okay. So next up is County Commissioner Gina Cerulli Thrasher. Gina, you want to go ahead and provide any comments?
Yes, thank you guys. I'll be very quick today. I just want to say thank you. It's been an entire year. The biggest thing that we're seeing at the county is just a hesitancy for the vaccine. So we're just trying to think of ways that we can try to motivate individuals to get the vaccine, because we're all going to be wearing these masks until we hit that 70% of population. Also at the county level, our CHIRP, our hospitality grant that Economic Growth Connection is doing for us, so that would be hotels, restaurants, anything in the hospitality industry. We still have, I believe, close to $2 million. So we just have not seen the level of applications that we expected to see. So if you know anyone in the restaurant, hotel, hospitality industry, please get them in touch with Economic Growth Connection to be able to receive that state funding. Also on the county level, not COVID related, but like every year, we have last minute cancellations for our poll workers on election day. So every day we think we have a full slate of poll workers, and then the next morning we have cancellations. So please, if anyone is interested in working on election day, please get that word out for us. Thank you.
Thank you so much. And the next up, I believe, is Bud Mertz, Director of Public Safety.
All right, thank you, and good morning, everybody. I just a very short report as things go on. I mean, obviously, we have to. There's been a decrease in cases, and as Dr. Fox reported, the numbers have been down drastically, but that still doesn't mean that the infection is not spreading. And that's probably our primary goal, is to maintain that vigilance that we have to try to save the people from getting sick. And so that remains an issue for us as we go forward. We continue to work on identifying the residents in Westmoreland County that want the vaccine, that have difficulties getting the vaccine. As we reported on the Homebound initiative, It's been a tremendous experience because it involves so many entities on the human service side, the public health side, emergency management and first responders. But that seems to be coming together that very well, that we're starting to put shots in the arms of those that have registered, that we've identified going forward. We're finding a couple glitches in the program. What has happened since then, and based on the human service side with United Way identifying the entities that have homebound patients, and then getting the list of names, as well as through the Area Agency on Aging. The second point is identifying Excella Health as being the vaccine provider, and they then go into a contract with the local ambulance services in order to for them to go out and administer the vaccine. And as we then map those routes out for them based on the list that has been provided, and divide them up into the various ambulance services that have agreed to do that, we see that at some point that they're not answering their phones. They might not, or that when the EMTs arrive to, the paramedics arrive to administer the vaccine, that maybe there's some hesitancy in going forward. So we're trying to work a lot of those out behind the scenes here, so that the program runs a lot smoother. But in most part, most of them are very anxious to get the vaccine and move on with a normal life. So we look forward for that program to end. And as Commissioner Sorelli said, we are trying to do whatever we can through our social media and outreach programs to encourage, to eliminate the hesitancy for the vaccine and get more people covered. So we're definitely doing our part in the outreach of encouraging the vaccinations, and through however media that we can use to answer any questions that people may have, or whatever it takes to get them to get a shot. So that's a lot of the work that we're doing here moving forward. I have to basically say thank you to everybody for this homebound initiative, because there was a lot of work put into it. A lot of entities that I received emails from a lot of different human services committee that took the time to identify their homebound folks. Everything that went through the United Way this past year, I think that our county would have been lost without United Way and Alyssa and what she's done for us. It's just been marvelous. This has been a tremendous partnership, and I'm proud to be part of it. And I'm proud to be part of this group. So thank you very much.
Thank you so much, Bud. It wouldn't have been possible without you and your team either. So I think definitely was a group effort this whole year. So I appreciate those words. Thank you.
Thank you so much, Bud. Next up, and please let me know if I am pronouncing your name correctly. We haven't met yet. It's Raji Jayakrishnan.
Yes, Raji Jayakrishnan. Good
All right.
morning, everyone. Nice to see you all. Yeah, I'm a recent entry into this meeting. This is my second meeting here, but I see there is a lot of value in what you're all discussing and taking time to talk about. The primary update I have for CHC Community Health Clinic is that we will be receiving a medical mobile unit the middle of next month, which is under the CARES Act funding, and it will be equipped for testing, COVID testing, vaccine rollout, and then possibly primary care also. And for those individuals who have a hard time reaching basic primary care access. And so please reach out to us if there are any pockets that are not immunized, or if there are outbreaks, or eventually even for the booster shots is what we see ourselves working with. In addition to Dr. Fox's comment on Pfizer for 12 and older, I do want to let you know that Moderna is in the pipeline to be approved for 12 and older sometime in July. So that would also be available in addition to Pfizer for 12 and older. And that was the main thing I wanted to bring to your attention. Thank you.
Thank you so much for joining, and we're excited to have you. Next up, we have Texi Waddell. Hopefully I pronounced that right. And she is Director of Agency Relations from the Westmoreland County Food Bank, sitting in for Jennifer Miller. So, Texi.
Okay, thank you. So our 42 food pantries throughout the county are in full operation with holding their once a month distributions. We are able to provide emergency food as well as referrals for ongoing assistance through those food pantries so that people can receive the food in their local community. Most of our food pantries are still operating with a minimum number of volunteers in a drive-through process. We have been doing our best to circulate information on vaccine availability as we receive it. Many of our agency coordinators have different ways to share out that information in their local communities. So if anyone has information and flyers and such on where vaccines are available, they have been coming through to me, and I've been relaying those out to our agencies, and will continue to do so. Our meal programs, that several of them have been closed due to the pandemic. They're beginning to think about opening or making plans to open up again, and most are planning to go with grab and go meals, at least for now. Our Operation Fresh Express is back up and running. This is our program that provides a mobile distribution once a week at a predetermined location in the county. It was on hold all last year through COVID. It is operating in a grab and go process and is open to anyone that can make it there. So we've been posting those distribution locations on our social media and such. And that's about it of what's going on here at the Westmoreland County Food Bank. I think this is a great opportunity to share information out through this these meetings. So thank you for allowing us to be part of it.
Thanks so much, Texi, for joining us today for the update. Alyssa, Deb Thackrath did shoot me an email. She was having technical difficulties getting in. I'm gonna see if I can connect with her, with Edward, to come on after, before the call ends.
Okay.
So you can go on to the next.
Okay, great. Thanks.
Sure. Next up is Dan Carney, Executive Director of Union Mission. Dan?
Good morning. Thanks everybody for allowing me to be here and to share a little bit about a couple of things I think that are important. There's a lot going on relative to, as Alyssa said earlier, the emergency rent assistance program that has opened officially for us in this county last month on the 12th. We are processing right now close to 500 applications for that program, and since it opened this month, over the last 4 weeks, we have probably another 300, 350 that we are anticipating based on mailed out applications. It's important for people to know it's a renters-based program, so it is for renters in Westmoreland County who are under 80% AMI and that have some form of COVID impact and have had an economic loss, and will help with 12 months of rent arrears or assistance going forward. For a total of 12 months of assistance and utility assistance for utility arrears. We will have an opportunity to evaluate as we spend down the funding to do an additional 3 months of assistance for households. So a total of up to 15 months of assistance is available. We've had a lot of questions around homeowners And the American Rescue Plan did allocate funding for a homeowners assistance program, and that was about $9.9 billion that it was set aside for that program. Those will be administered by the states, and I don't have any new information on that or when that will be kicking off. But if you're working with homeowners, there is some relief coming along the way, and just trying to help them navigate the resources that are currently available to assist. So there are opportunities with the normal partners, the Housing Authority, Catholic Charities, 211, and your normal housing and other assistance providers. We're trying to help kind of prioritize across that network where people need relief and how we can help some folks hold on till these other relief programs come in. But we do notice, and you may be dealing with people who are frustrated at it's an odd time to have more resources than we probably need, but still helping people navigate. And there's so much information for them to digest and to know where to apply. So don't hesitate to send anybody our way. We'll try to navigate them to the right place. Or if they get connected with any of those other agencies I mentioned, they'll also help to try to connect. We're all trying to work together behind the scenes to get the biggest impact for folks, but also to make sure it's the right program that they're getting connected to for the assistance that they need. The shelter programs in our county continue to operate. There is additional housing programs that are running and operating to support people who might be dealing with more than just housing instability, but actual homelessness or the needing to flee a domestic violence or other potentially life-threatening housing situation. So those resources still remain available and are running strong for those folks that might have a need. So help is on the way for the homeowners, and the rent relief program they can access through our website, www.theunionmission.org. If you throw a /ERAP, E-R-A-P on the end of that, it'll take them right to the portal. But if you go to our main page, there's a pop-up that opens up. They can, on that page, download an application as well if they don't want to complete it online. Or if they call or email, there's a sign-up option. We will mail them an application as well, since it's some number of pages. So if you have any questions, don't hesitate to reach out. Thanks so much.
Thanks so much, Dan. And I think Deb was still having a little bit of trouble with her audio, but she was able to shoot us over a message with an update. Deb just wants folks to know that Feed the Spirit meals continue to remain stable at about 200 meals per week. So Deb, if you can hear us, thank you for the update. And we'll look forward to seeing you next time. Next up, we have Rachel Buzanas. Did I get that one right? Yeah. Community outreach specialist with Gateway Rehab, and Rachel requested a few minutes today to walk through some information about Gateway Rehab and the services they're able to provide currently. So go ahead, Rachel.
Okay. Yeah, so for those of you who are not really familiar with Gateway, I'm just going to, like McCray said, just briefly talk about it, and then also talk about what we're doing for COVID. So our background, we're actually a nonprofit organization. We opened our doors in 1972, and we had the idea in mind of creating a place where one could become healthy in body, mind, and spirit. Our founder was actually a rabbi and a psychiatrist named Dr. Abraham Twersky. And he saw the need for refuge and recovery for those suffering from substance use disorder. And he just sadly passed away at the age of 90 from COVID. So our locations, I don't know, McCray, if you have that slide, those slides that I sent, but I had a list of our locations.
The next slide
here. Yes, thank you so much. There we go. So we have 2 detox and inpatient locations in Aliquippa, which is our main campus, and then we have one in Westmoreland as well. And we have a long-term residential treatment facility. It's in Aliquippa, 5 outpatient locations, which they do partial hospitalization programs, intensive outpatient programs, and those are hybrid right now with telehealth. We do regular outpatient, and we also do outpatient career groups. So we have like a nurses group, a doctors group, and a pilots group. And what it does is the outpatient group assists in getting those doctors or those nurses or that pilot getting their license back so they can practice their craft after they've gone through rehab. So if you want to skip to the next slide. So what are we doing for COVID? So we're doing screening. That has helped tremendously. That's on the front end. So the main thing we're doing though, other than screening and staff vaccinations, they were offered to everyone on the staff, and as far as I know, everyone has gotten a vaccination, and that especially works directly with the patient. We have something called cohort. So we're actually admitting our patients in cohorts, so in little groups at specific times of the day. So how does that work, and why does it work? So when someone has been scheduled for an admission, at that time they're aware that they will be in the same room for 5 days, whether that be a room in detox or an inpatient, depending on their needs. At our Westmoreland inpatient site, we have a special cohort unit that we have set up. Every patient spends 5 days in a designated room on the detox side of the facility until they are able to move to the other side. That's primarily going on at Westmoreland with the special cohort unit. It's a little bit different at our main campus. So the cohort is that they room with someone who is also admitted the same day that they did. If there is no one to place them with, let's say they were all the only ones in that cohort that came in at 10:30 or something like that admission, then they usually would just room alone. So the idea behind this is that we are trying to monitor the patient for 5 days. And if we were to have a positive, then the exposure is very minimal. So this actually so far has worked extremely well, and we've not had an outbreak that has been a disruption to therapy. This like last year and this year. So and then I already went over vaccinations. So that is what we are doing. Also the telehealth helps and reduction of foot traffic. So if you want to go to the next slide, I'll talk a little bit more about Gateway. So we take all commercial insurances, even Medicaid pending, and we will help patients get Medicaid. So we also have a case-by-case charity fund, kind of an internal fund. We call it the Tversky Fund, since he's our founder. We have heard in the past there's been issues with transportation in the more rural areas. And within Westmoreland, like Fayette, Indiana, like they've had a hard time getting their patients to our Westmoreland inpatient site, which is connected to Frick Hospital, by the way. And so we actually started just this past year, we started an Uber medical account, if you've ever heard of that. So there's actually at least one Uber driver in the Westmoreland area, part of this Uber medical account, that can take a patient to Westmoreland inpatient or Aliquippa, whichever is requested. So if you want to switch to the next slide. I think this is the last one. So I am actually moving back home with my husband to Texas. Our family lives there. So June 2nd is sadly going to be my last day, but I've really appreciated these calls. I've really appreciated our time together. So this is my my supervisor's information. Her name is Tracy Plevel. and you can reach her at that email and the phone number there. What I'll do is actually put my personal phone number in the chat. I also use it for work, and if you have any questions, you can just shoot me a text anytime. That's until June 2nd. So, I appreciate everyone's time this morning, and thank you again. And feel free to visit our website or call or text me if you have any questions, or my supervisor. Thank you so much.
Thank you so much, Rachel. I appreciate it. So thank you to everybody who shared the helpful information today. And we have our next call on Thursday, June 10th at 8 a.m. That is the last one that we technically have scheduled right now on the system, but the other dates are for the future will be July 8th and August 12th. Assuming that we're going to keep moving forward with the calls. Alyssa, do you have any comments on that?
I think these calls are so valuable, and even when we get through and beyond COVID, I think we could morph these into something that's helpful for our providers in Westmoreland County, and to have kind of the same group of people chiming in with updates and information. So that's my 2 cents. I think we could continue it, and I've heard from other people that they really think these are valuable calls. Yeah. So I think we could, definitely take comments and information from people, or if people think there's a different format or information we could provide.
Yeah, please let us know. You can either reach out to myself or Alyssa with any feedback, and what we will do is work on getting them scheduled. We'll do it through the end of the year, so they're reserved on everybody's calendars, and we have the technology all set up and working. And I want to thank everybody. Alyssa, is there anything else that I'm forgetting, or any other comments you want to make?
Nope. Great job, McCray.
Okay,
Thank you.
Thanks. All right. Thank you all. Bye.
Have a good day. Take care. Bye-bye.